So I've been working at the Council of Economic Advisors for about a month and a half. I am in the Eisenhower Executive Office Building. It is located just next door to the White House. And in fact, I have a really nice view of the front of the White House from my window. On my first day, just getting the badges, fingerprints, and all of that set up actually took quite a while. I haven't seen her, but the office of the vice president is in this building. So I have walked by a few times just hoping to catch a glimpse, but haven't caught one yet. We set up a whole new household here in Virginia. So our place is fully functional. This past weekend was awesome. It was very nice weather over the Labor Day weekend. Basically, we were tourists in DC over the weekend.
Bye, Kieran.
The kids have adjusted really well. You know what? I'm getting a call that I have to take. So
Sure.
Hold on
Go
one
for it.
second.
Okay.
Okay, well, this is something that does happen sometimes where I just get called into a meeting that's happening right now. And unfortunately, I kind of have to take off. So I'll ping you both if it gets done quickly, and otherwise we can try to reschedule.
Good evening, and thank you for joining us. President Biden is taking off the gloves to get more Americans to roll up their sleeves.
When we were last chatting, I got a phone call. I was asked to basically meet with a small group of people. The topic of the conversation was actually that the president was going to be making a big speech later that day.
President Biden is calling on the Labor Department to compel large and mid-sized private companies to get their workers vaccinated or face fines.
I was given a heads up about some of the components of that speech because they were areas that the CEA would be somewhat involved in.
Tonight, President Biden acknowledged the COVID challenges crippling the country, warning things won't improve until the unvaccinated get their shots.
President Biden, in his speech, announced new workplace safety regulations to combat COVID-19. One of the questions might be, who should fall under that regulation? What is the scope of this regulation? How quickly should it take effect? What are the specifics of how that regulation will play out? So in the last 2 weeks, I've been heavily involved in these efforts. Seeing something develop from kind of the ground up has been really interesting and also rewarding. I can see the direct impacts of some of my efforts and how they can shape the way that some of these things roll out. Economists do have a seat at the table, and I've recognized the value of what economics can bring to the table. At first, it was a bit scary to be working on something that was going to be affecting so many people. I've come to realize that even if I don't know all of the research in any one particular area, I know enough about research and about economics that I can basically be a good filter for the data and the studies that are out there and ensure that they're used appropriately in the right context. I think something that this has really opened my eyes to is just how much policy is made through regulation and rulemaking rather than through legislation necessarily. And so like the Affordable Care Act, for example, is like one large piece of legislation that had immense effects on health insurance coverage and the way that healthcare is delivered. But after that legislation was passed, there was a million details that had to be worked out. There are a lot of important policy decisions being made when those rules are being worked out that I didn't fully appreciate, I think, until I was sitting where I am right now. I have another meeting, and I know you have a staff meeting because I just saw a reminder come up.
Okay, go. Thank you so much. We'll catch up
Awesome.
later, Gopi. But
Okay, sounds good.